psychological, emotional abuse, or inflicted distress. What acts or situations constitute the presence of the risk? Psychological and emotional abuse, or the infliction of distress, can refer to direct acts perpetrated with the intention of causing harm, as well as the indirect results of the infliction of these types of mental or emotional pains or injuries. Conflict and crisis settings often lead to prolonged mental health challenges, especially when states fail to ensure available and accessible support systems. These issues affect individuals, families, and entire communities over time. They additionally deepen mental health issues, strain support systems, and fracture families and communities. Insecurity, violence, loss, and the collapse of basic services further compound the psychological and social toll. What factors must be identified for monitoring? This protection risk includes a broad spectrum of emotionally and psychologically harmful actions, ranging from verbal harassment and intimidation to forced isolation, destruction of cherished belongings, and stalking. In situations of conflict and displacement, such acts may be widespread and sustained, impacting people at the individual, household, and community level. Monitoring must capture both psychological aspects, like thoughts, emotions, behaviors, and coping mechanisms, and psychosocial dimensions, such as disruptions to relationships, social networks, roles, cultural practices, or spiritual life. Children deserve special consideration. Their neurological systems are still developing, making them highly sensitive to emotional shocks. Exposure to trauma, malnutrition, or chronic stress during early years can impair cognitive development and result in long-lasting psychological disorders. What information and data can illustrate the presence of the risk? To monitor this risk, data should come from mental health and psychosocial support providers, as well as child protection and GBV actors. This includes the number and type of cases reported, the functionality of referral and support systems, and whether people have access to mental health services, justice, and protective frameworks. Gaps in services, lack of authority response, and ongoing conditions like violence or food insecurity can all signal a heightened risk. Together, this data helps identify where people are suffering in silence and what actions are needed to support their mental well-being and resilience.